Dear student of Mainamoti Medical College, how are you? Today I will discuss about bone marrow study, the hematology. Previously I discussed general pathology, necrosis, apoptosis, cell injury. Today is in hematology, bone marrow study. Bone marrow study examination of structure and cellular composition of bone marrow is aspirate and prepping biopsy essential for diagnostic purposes in a wide variety of disorder affecting the hematopoietic system. Disorder of hematopoietic system. Structure of normal bone marrow. The red marrow intersper between the trabeculae of bone within the body cavity contain specialized connective tissue cells, reticular fibers, blood vessels, fat cell, nerves, macrophage, in addition of cells of the lymphoid and hematopoietic series. Indication of bone marrow study for diagnostic purposes: red cell disorder, megaloblastic anemia, aplastic anemia, pancytopenia, some cases hypochromic anemia, sideroblastic anemia. In case of white cell disorder, leukemia, especially subleukemic leukemia, neutropenia, agrarocytosis, leukomoid reaction, leukoerythroblastic reaction, multiple myeloma, lymphoma. Platelet disorders, idiopathic thrombocytopenic purpura, that is ITP, hypersplenism, Kala-Azar, lipid storage disease. These are the diagnostic purposes. Then assessing response to disease, acute leukemia, assessing prognosis of the disease, aplastic anemia, agranulocytosis. There is contraindication of bone marrow study, hemophilia, other coagulation disorder. Site of collection of bone marrow: sternum, iliac crest, anterior posterior iliac spine, tibia. Sternum, first or second pitches of the body of the sternum. The usual site of puncture is the manubrium or the first or second pitches of the body of the sternum. In case of adult, iliac crest. Anterior and posterior iliac spine have the advantage that if no material is aspirated, microtubule biopsy can be performed immediately. Tibia, for the child below 2 years of age, medial aspect of the upper end of the tibia, just below the level of tibial tubercle. Technique: how you will collect the bone marrow. First, the patient lies on his bed. Clean the area to be aspirated with iodine and split. Anesthetize the local area up to periosteum with local anesthetic drug. Adjust guard on the needle of about half inch from the needle point. Put the needle into the bone by boring motion. Remove the stellate. Draw about 0.2 ml of marrow with a syringe. Make films on glass slide from marrow fragments. Fix films with methyl alcohol for 20 minutes. Stain with any of the Romanesque stain, that is Lispinus or GFS stain. Successful aspiration is accompanied by transient pain. Bone marrow biopsy. Aspiration of particles of bone marrow by suction by a wide bone needle inserted into the bone marrow cavity is usually method of choice for obtaining bone marrow for diagnostic purposes. Advantages of this type of approach are: film prepared from aspirate materials can be examined almost immediately, and the morphological details is superior to the histological section of core biopsy obtained by trypsin biopsy. procedure. The bone marrow treatment biopsy, on the other hand, provides a more reliable index of cellularity of hematopoietic elements and reveals certain abnormalities such as neoplastic cells or fibrotic materials, which may not be dislodged from the marrow cavity by suction. That is, in case of failed or blood tape, failed aspiration by needle biopsy, bone marrow treatment biopsy should be done. It is a reliable index of the cellularity of hematopoietic cells. Failed aspiration, right tape, blood tape. Failure to aspirate any materials at all is referred to as right tape, and blood tape, aspiration of blood without particles, is called blood tape. Right tapes means the no absence of any particles or any materials. Blood tape, only aspiration of blood without particles is called blood tape. Two factors are responsible for failed aspiration. One is technical factors, failure to sight the tip of the needle into the bone marrow or to apply sufficient suction. Pathological factors is the most common factors which prevents the disruption of the bone marrow into particle of suitable size for aspiration. Pathological causes are myelofibrosis, hairy cell leukemia, myeloproliferative disorder, lymphoma, metastatic carcinoma, tuberculosis, multiple myeloma, aplastic anemia. Complication of bone marrow puncture, suction pain, hematoma, infection, death due to shock and hemorrhage. After collection, examination of bone marrow. First, collection of marrow particles, then making slide by particles fragments, and then stain with Lichtenstein or James stain, then examination under microscope. Examination of bone marrow fins. The low power objective is used in assessing the general cellularity, and the high power and oval immersion objective are used in noting cellular details. The following information can be obtained from marrow film examination. First, cellularity of the marrow. This is determined by examining the number and cellularity of the cell traits. When the aspect appears to be only blood or blood with a few marrow particles, marrow cells, all the slides should be carefully searched for marrow fragments using a low power scanning lens. This is the important in case of suspected aplastic anemia. Number two, myeloid ratio. The myeloid ratio is determined on 200 to 500 cells. Normally, the ratio is 2.5 to 15 is to 1. Type and activity of erythropoiesis. Type and activities of erythropoiesis. Type, it may be either normoblastic or megaloblastic. May be also sideroblastic. Activity and maturity can be roughly estimated from the number and general maturity of erythroplasts seen in the cell trait. Leukopoiesis, number and general maturity of the developing granulocytes are noted together with any abnormality, toxic granulation, and atypical cells. Number and types of megakaryocytes, the number, types, and the presence of platelet formation are noted. The presence of foreign or tumor cells, malignant cells, presence of parasites or organism. This can be sometimes be demonstrated in marrow in certain disorder, the Kalajo, malaria, histoplasmosis, tuberculosis. The iron content of marrow, this can be assessed either by the direct admission unstain, marrow fragments, or by special stain. For iron, iron can be demonstrated by Prussian blue granules. In normal marrow, small amount of iron is present. It is absent in iron deficiency anemia and increase in transfusion hemosiderosis, hemochromatosis, refractory sideroblastic anemia. These are the bone marrow study